Libtards and gentlemen, this is a response to the cut and paste piece of sophistry by KataVideo titled GOP Healthcare. Don't give people what they want. Or maybe it's actually, if she said it to me, GOP Healthcare. Don't give people what they want. Hence the changing of the voice. But either way, this video is really short, as are most of Kaka's videos, and there's two reasons for this, people. Number one, her audience has the attention span of a squirrel. And number two, she literally pours all of her knowledge into a video, hence the short time limit. Kaka's video here is based on the false premise that just because a majority of people want X, whether that's actually true or not, makes it valid. I'll attack this in two ways. Number one, I'll use examples of other things that people do or don't want and use that against Kaka. And number two, we can't pay for our current programs. What makes her think we can pay for socialized medicine? First, let's use Kaka's argument against her. Let's give the people what they don't want, in this case, homosexual marriage. In fact, in 2006 alone, homosexual marriage was defeated by the voters in South Dakota, Virginia, Wisconsin, Idaho, South Carolina, Tennessee, and in Colorado there was a ballot initiative to grant homosexual couples, quote unquote, the same benefits as their heterosexual counterparts. That was defeated as well. It can't even win on the ballot in California or Hawaii, which are liberal enclaves. I guess Kaka is now on board with giving people something they don't want: homosexual marriage. Let's look at one more item. A Zogby poll commissioned by the Seattle-based Discovery Institute says more than 3/4 of Americans would like teachers to have the freedom to discuss both the strengths and weaknesses of Darwinian evolution, with an even higher number reported among Democrats. According to the report, which was commissioned by the Discovery Institute Center for Science and Culture, respondents were given the two following statements. Statement A reads thus: biology teachers should teach only Darwin's theory of evolution and the scientific evidence that supports it. Statement B: biology teachers should teach Darwin's theory of evolution, but also the scientific evidence against it. Of those surveyed, 78% said statement B came closest to their own point of view on the issue, representing a 9% increase over 2006, the last time the question was asked. Using your fallacious reasoning, we'll give people what they want there as well. Biology teachers should teach Darwin's theory of evolution, but also the scientific evidence against it. For example, what mutation could possibly be used to explain the origin of cleaning symbiosis? We're sure the answer to that lies somewhere in the recesses of Kaka's tiny brain pan. Lastly, let's deal with what will happen when millions of people flood this option, which she actually went over her video when she cut and pasted Charles Grassley, one of my senators, talking to some clown in the antique media. They think letting the government pay for healthcare would be so cool. I'll refer everyone to the links on the right side, which will give you detailed information. It's much better than a one and a half minute cut and paste video, but Hawaii already tried. I don't know, she's probably not aware of this. Hawaii already tried universal health care for children, and the wheels came off in less than a year. It was unsustainable even for a small state with a small population. State officials found families were dropping private coverage to enroll their children in the plan. In fact, 85% of the children in Kaiki Care, if I'm pronouncing that right, Kaiki Care, previously had been covered under a private nonprofit plan that cost $55 a month. When Governor Linda Lingle saw the data, she pulled the plug on funding. She realized it was unwise to spend public money to replace private coverage that children already had. Yet Lingle is facing a political firestorm from critics who say she's denying children health insurance. Oh, identity politics. Oh, they're smearing her with emotional appeals. That's so new. Even though children in Hawaiian families earning up to $73,000 a year are eligible for Medicaid. So you can see how, just as Grassley said there, and once in a while Chuck does make sense, there's going to be all kinds of people who say, oh, I got private insurance, I'm paying for everything okay, but, you know, maybe I can just dump that and get on the government dole and then I can buy a new car. But there's no such thing as a free lunch because it comes from somebody. She doesn't know that yet, evidently. The health scare reform in Massachusetts is faring no better. With doctors now, they're not accepting new enrollees, many of them, and the plan is way over budget. But this won't deter Kaka. She'll just say, fund it. Fund it with what? You plan on printing over $40 trillion to pay for our Social Security pyramid scheme and Medicare, unfunded liabilities, and then several trillion more to pay for Orwellian, Canadian-style single-payer health care? Obviously, you need an economics class in a bad way. We don't have the money to pay for this. Gave you an example from Hawaii. People were just dumping their private coverage so they could get the government to pay for it when they were able to pay for it on their own. Families making well over 70 grand were eligible for Medicaid in Hawaii. See, they'd get a waiver from the federal government to cover people making a lot more. And then taxpayers in Iowa get to pay for the health care for children in Hawaii. But luckily, Lingle saw the handwriting on the wall, saw what was happening there, saw they couldn't pay for it, and pulled the plug on it. So no, your public option is nothing more than a deny private insurance option. And I have pretty good private insurance because I don't want all these gold-plated mandates and things like that. So therefore, my premiums are lower. But when everybody exits this private insurance and goes over to your public option like they did in Hawaii, it's going to crowd private insurance out. And then, of course, we're going to have more liabilities. So unless you plan on getting those printing presses going and printing a whole bunch of money, which, of course, as you probably don't know, will fuel inflation, it's unsustainable. It won't work. So you're probably going to have to come up with a better video than that. Good luck.